Hello class, hello professor. Today I'm talking about my patient who came to our clinic with the right shoulder pain. She's a 47 years old female, born November 6, 1977. She's white Armenian, came to clinic accompanied by herself. She's a reliable historian. Her chief complaint was my right shoulder has been hurting for 2 weeks after lifting in a heavy stuff, helping her husband. She came in and the pain is for 2 weeks after lifting a heavy stuff. Her pain started 2 weeks ago and is anterior or lateral part of her shoulder. She states her pain is a dull during rest and sharp stabbing pain during abduction. And she at rated 310 during the rest and 610 during movement. Pain gets aggravated and she tries to lift when she tries to lift something or try to reach overhead or sleep on the right side. Her pain gets better with rest, ice, and occasional ibuprofen. She denies any tingling or numbness, but she felt mild stiffness and occasional popping sensation on there. Her past medical history, she has a hyperlipidemia, which has been controlled by Crestor 10 milligram. Her last physical, dental, and eye exam was 9 months ago. She had no prior shoulder injury or shoulder pain. The surgical history, the only surgery she had was a C-section that happened 16 years ago, and she was hospitalized for 3 days for that surgery. She has no medication, food, environmental, or latex allergy. Medication, as I said, she takes Crestor 10 milligram, 1 tab by mouth every night, and ibuprofen 200 milligram, 2 tab by mouth every 6 hours for the pain. All of her vaccinations are up to date. She got her last flu vaccine September of 2024, and she had 3 doses of the COVID vaccine. Her last menstrual cycle was on July. Pregnancy, she had 1 pregnancy, 1 birth, and no abortion. Her social history, she's an accountant and she works 5 days a week and she's off on a weekend. She's going for running every evening with her husband. She drinks 2 cups of coffee every day, denies smoking, using of illegal drugs. She drinks alcohol on occasional basis. She has a Mediterranean diet and does not drink any carbonated drinks. She keeps her medication in her bedroom next to her bed. They have guns at home that there's in a lockbox in a closet. They have an alarm and they have carbon monoxide detector in their hats. She wears seat belts when she's driving or she's on a passenger seat. She's sexually active with her husband and she has implantable birth control. Her family history, she's been married for 22 years and lived with her husband and a teenage son in a single family home. Has 2 younger brothers. Her older brother is 43-year-old and has history of anxiety, and she doesn't know what type of medication, but she knows he takes some medication. Her younger brother is absolutely 41-year-old and is a healthy individual. Her mother, she's 69 years old, and she has history of obesity and hyperthyroidism. And her father is 73 years old, and he has a history of hyperlipidemia. She states that lost her maternal grandfather at age of 63 due to the heart attack, and her maternal grandmother at age of 81 due to stroke. Her paternal grandmother died at age of 23 during childbirth. She never seen her paternal grandmother, and she lost her paternal grandfather at age of 83 due to prostate cancer. The review of system: general, no fever, no chills or weight loss. Cardiovascular, no chest pain, no skip of beats or palpitation. Respiratory, no shortness of breath, cough or wheezing. Musculoskeletal, right shoulder pain, stiffness, decreased range of motion. Skin, denies any bruises, redness, or lesion. Neuro, denies any weakness, numbness, or tingling. Her vital signs are in a normal, within normal limit. The physical exams that I performed for her was general. She was alert, well-dressed, no acute distress. Cardiovascular auscultation of S1 and S2, no gallop or murmur was present. Auscultation of lungs, they were clear bilaterally, anterior and posteriorly, no wheezing or rhonchi. Musculoskeleton tender over the anterior shoulder and lateral deltoid. Range of motion mildly limited. Skin, no redness, bruises, or warm to skin. Neuro, intact sensation and present of the pulses, distal pulses. For this visit, I didn't do any labs, no labs, but I performed some diagnostic testing. I did NIRS test, she was positive. Pain for the forward flexion. Hopkins-Kennedy, she was positive. Drop arm test, negative. Cross body adduction, mild discomfort, she felt it. The diagnosis that we had, the main diagnosis for her was right shoulder impingement, ICD code M7541, which is also the rationale behind it was positive for NIRS and Hopkins test. And also she had symptoms like when she's sleeping on the right side, she has that pain. The differential diagnosis that I had rotator cuff tear, ICD-10 of M75102. I have acromioclavicle joint arthritis, which is less likely, and this is an injury happening mainly for the athletes that they are participating in a contact or overhead throw sports. And the fourth diagnosis that I had, adhesive capsulitis, which is mainly known as frozen shoulder, which I ruled out this situation for her. Diagnosis, avoid lifting for her, ibuprofen every 6 to 8 hours as needed, rest and ice. Education important to early gentle movements for her. Then ice is best for first 48 hours after flare-up, then alter with the heat stiffness. Follow-up, consider physical therapy in 2 weeks. Follow-up if needs sooner if she sees increase the pain, weakness and numbness. Seek immediate care if experiencing sudden weakness, numbness, severe swelling. Thank you very much.